And today we're going to talk about the bunion classification system, which I believe is the secret to successful treatment, the secret to successful outcomes, and the secret to kind of getting you over your issues here. Here's my email, and that is a website that you can go to find out more about the program. Order. First, we're going to talk about me. We're going to talk about why bunions form. We're going to talk about the various different bunion types. We're going to talk about prognosis for those bunion types. We're going to talk about the different bunion treatments. We're going to talk about why I chose to develop the Bunion Solution 4.0 Plus, and then I will give you some special offers for attending. For those of you who just kind of came on, by the way, in the chat box, the first thing that's up there, if you scroll up, is a 20% discount to something called dynamic tape with a coupon code. So you might want to copy that and put it in your notes. So anyway, me. So from about 1991, really 87, till about 2008, that's 20 years, I really got involved in my education. So I have 3 college degrees. One's in fitness and cardiac rehab. I have a master's in exercise science and a bachelor's in physical therapy. In 2008, I was certified as a functional manual therapist with the Institute of Physical Arts. And going back after I graduated PT school in 1998, I decided that I wanted to create online programs using the internet to empower people to take control of their health and healing. And it's taken me over 20 years to do that. But here I am. In 2008, I began teaching live seminars to PTs and other healthcare professionals. I became interested in correcting the foot after teaching balance enhancement and fall prevention because we don't usually fall sitting down. We fall when we're standing. And so what's the difference? It's the foot. I launched my first online program in 2015. 2015, the Bunion Solution. We are now on 4.0 plus. And 2018 launched other foot and ankle solutions, worked with people via telehealth. 2020, created a program called Correcticize, which is more of a whole body program. And we'll talk about that a little bit later as well. Here's my mission. Recently, on Facebook, I saw this meme, so I stole it, and I love it. A healer is not someone that you go to for healing. A healer is someone that triggers within you your own ability to heal yourself. And that has been my mission for, close to 30 years. It's to empower people to resolve their own physical dysfunctions and pain so that they can enjoy the life that they choose to live, because it's your decision. It's your quality of life is up to you. And I want to teach you how to have a high quality of life if that's what you are choosing. Okay, so on to bunions. Why do they form? So why do we have these malalignments? And I have a saying, we are a manifestation of our habits and our compensations. So some dysfunctions are a manifestation of compensations elsewhere in the body, and other ones are because of habit. So the structure of the body will change, will literally change to respond to forces acting on it. This is something called Wolff's Law, if you want to look into it. And the other reason that the body will change is to maintain balance and not fall. So if you have a scoliosis, that will, you will adapt to it, right? You don't side bend your back when you have a scoliosis problem. And that is what the body will do. It will do anything to maintain balance. And the number one reason for balance compensations is to get weight onto the big toe. So the big toe is the primary balancer in the foot. It is integral. And that's one of the reasons why I feel it is vital to have the big toe functioning in your body as optimally as possible, given any kind of circumstance. So if you have flat feet, or if you know somebody who has flat feet, that is one of the biggest, the compensation or the reason that people have flat feet is to get the big toe on the ground. So if I have somebody in front of me who has a flat foot and I remove their compensations, meaning I literally take their body and move it where it should be, their big toe will come off the ground. So there's a reason that people have adopted the posture that they have. And like I said, it's either to balance or maintain eyes on the horizon is the other one. So compensations are caused by forces, and they can be due to anatomy, because it could just be that way, trauma, habit, or a combination. So some people will develop, abnormalities or compensations like in utero, right? So they're, if you put connective tissue in the same position over a period of time, like, the skeleton here who's on Zoom at work, then the body tends to stay that way. And a great example of this is when you've taken a long plane or car ride. And if you've ever done that, when you get up after a couple of hours, you're stiff. That's connective tissue. So when you think about assuming this kind of posture for, hours, days, weeks, months, years, the body actually adapts. And research is now showing actually that many of us are developing an extra vertebra due to cell phone use. So the body is, like I said, it's amazingly adaptive in good ways and then not so good ways. So the definition of a bunion is a bony bump that forms on the joint at the base of your big toe or your little toe. And here are some myths associated with bunions. One, they're a toe problem. Okay, yes, they are a toe problem, but they don't originate. They're not caused by the toes. The toes just don't magically go ahead and decide to assume the position that they assume. It's a compensation to maintain balance. Or again, it could be due to some sort of trauma or habit, which could be the whole shoe theory. Okay, because again, a lot of people believe that it's narrow, tight shoes, and maybe, but you have to be wearing those shoes quite a bit. Bunions are genetic. Foot anatomy is genetic, but that doesn't mean that you have to get bunions if your grandmother had bunions. A lot of family members do. A lot of family members have the same foot style or the same feet, but that's not your destiny. So my daughter actually has her dad's feet, and he has horribly flat feet, but she doesn't because her mom worked on her foot since she was born. So she does not. You cannot change a bunion naturally, and that's not true. You can change. I change bodies. If you ask me what I do, I would tell you that I change the alignment of bodies. That is the primary thing that I do. And I do it through a system that I'll share with you a little bit later. But I change the anatomy of, 80-year-old scoliosis people. I've changed the anatomy of bunions. I've changed the anatomy of hammer toes. I've altered the anatomy of knee alignment, et cetera, et cetera. Some are more challenging than others, and we'll get into that. There are bunion types. So what are they? So there are there's the Taylor's bunion, also called a bunionette. That's a bunion on your pinky toe or fifth toe. You have a hallux limitus, hallux rigidus, which is more of an arthritis on the big toe joint. And I was talking about this a little bit earlier. For many people who think they have bunions, they might have hallux limitus, hallux rigidus, which is more of a buildup of bone, whereas a traditional bunion typically has a medial movement of the first metatarsal. That means that the bone that goes from the arch of the foot to the base of the big toe moves toward the arch of the foot. And then typically the big toe compensates by moving into or toward the second toe. And I have 4 subcategories for this. And this is where we'll get into the bunion types a little bit more. Forefoot, which is near the toes, or pretty much between the toes and the arch of the foot. Then there's a midfoot, which is usually caused by something going on around the arch or to the ankle. Then there's a walking bunion. That one is caused by a rotation in either the thigh or the lower leg. So when they're walking, every step that a person with a walking bunion takes feeds into their bunion becoming worse. So if you like walking and you have a walking bunion, you're really kind of adding fuel to the fire. And then there's a combination. So you can have a little bit of both of several of these. Typically the midfoot and the walking bunion are the combination. And many people will have bunions and also have talar bunions. So again, there's a big mishmash of a lot of different things. When we talk about the bunions of the little toe, there's a deviation either at the fifth metatarsal or the little toe, and where the little toe is moved toward the fourth toe. And there may also be a rotation. And this is an excellent candidate for non-surgical resolution. If you have a talar's bunion and it's painful, please don't get surgery. I don't think a lot of surgeries are done for this, but you don't need, a lot of people are in pain from it, and you don't need to go there. This is very easily treated non-surgically with the techniques that I do. And here's somebody who benefited from this. This is a guy who was 67 at the time, and he had a 3-day regimen of running. And he had a lot of pain on his little toe. But what was interesting is that with the taping techniques and the release techniques, not only did his talar bunion improve, but he had pain on the outside of his hip, which also diminished with that taping. And I'll tell you a little bit why in a little bit. Then there's the non-traditional bunion, the hallux rigidus. So here, there's no deviation of the big toe. It's just a bump right there. And that is really arthritis. And that is a bugaboo. Arthritis or any kind of inflammation shuts down core muscles by 1% for every cubic centimeter of inflammation. So inflammation, right, pain, so it shuts down the muscles that are designed to protect the joints. And then also it's giving you pain, so then you alter your gait. And then when you're walking, you're still putting pressure on an already arthritic area, which is like a trifecta of disaster. So these guys are, unfortunately, they wind up going through a cascade of surgeries and buying special shoes. And the good news is that it can be taken care of depending, it can be helped at any stage in it. And it can be certainly managed, if not cured, but you have to change the forces that are causing the arthritis. But you also have to address the inflammation as well as the core muscle strengthening, getting that all back. So again, you have to address it 3 ways simultaneously. So these ones are a little more challenging, but a non-surgical resolution, depending on severity and length of time, can be 6 to 12 weeks when you're doing the right things. Prognosis, if you don't do anything, is ultimately a surgery that involves a scraping of the arthritis out, and then eventually either a fusion or a joint replacement they're now doing. I recommend joint replacement. You want to try to keep that joint mobile. It's so important for your hip and for walking. So that one is a tough one. Okay, so here's somebody who had pain for 2 years. They were in a wheelchair for 8 months, 11 podiatrists, 4 chiropractors, and many physical therapists and massage therapists. I'm now able to walk and stroll my grandson 2 miles. Your program and taping methods really made a difference in my life. So things can be done when you address the right thing. It's just finding the right person and finding the right solution for you. And not every, there's no one solution for everybody. It's about finding the one that works best for you. Now we'll get into the traditional bunions. This is where there's a deviation of either the first metatarsal, which again runs from the arch to the base of the big toe, and it moves away from the big toe, or the big toe is moving toward the second toe. And the primary cause will vary, as does the prognosis, depending on the bunion type. So I have something called a functional bunion assessment, and you can do this if you'd like right now. And what it determines what your bunion type is. So then you can look at what the causes, the probable causes are of this bunion, right? So the bunion is a compensation. What is happening, right? What kind of compensations are going on that's causing that bunion to occur? So all you need is a piece of paper and a pen or pencil or marker. And you're just going to mark a point, several points, one at the inside ankle bone down to the floor, one at the arch of the foot down to the floor, then one at the metatarsal, which is where that big toe joint is, and then one at the tip of the toe. And then you'll just take those, your foot away and take a look at what it looks like. So this one is what I call the forefoot bunion. It's driven by the connective tissue or issues in the forefoot typically. And what that looks like is that the ankle and the arch the ankle, the arch, and the first metatarsal are in alignment, but the big toe then deviates. So all of this is good, but then the big toe moves. And then this person here, right? They're having, this is more of a hallux rigidus possibly, and this is definitely more of a bunion issue going on. And what is really interesting is when you're looking at this person standing, if you were on earlier, remember I talked about that rotation at the lower leg? If you notice here, look at this ankle, right? Ankle bone. And then look at this ankle bone. This one is rotated. So is it any surprise that there's a rotation going on at the foot? No, not at all. So this person needs rotational release, which I'll get into a little bit later to offset that. So so this is somebody who had some treatment, and she was able to improve the alignment of her big toe, as well as some of the hammer toe issues going on. If you see here, you don't see a lot of nail here. You're seeing a little bit more nail here, and then a little bit less grabbing into the ground, which happens a lot of times when people have a big toe problem. They'll develop a hammer toe or toes because they're compensating for a lack of balance, because when the big toe is not working properly, it's not able to perform its primary function, which is balance. The forefoot bunion is super easy or one of the easier ones to address, because there's kind of less going on, and there's not such a deviation of the big toe. But here's some prognosis. Here's some taping, and then prognosis over time. So this is going to be a year and a half later. Yeah, so some good progress. Now here you have a combination or a midfoot combination bunion. And these are the people who have a very, very, very narrow foot. They usually have a very high arch. And this is when that first metatarsal is just deviating out, because what's interesting is that the big toe is actually in alignment with the ankle, but it's this metatarsal that's being forced outward. So what we do with these people is we try to increase the mobility of the connective tissue in between these small little joints right here. And what we have to do, that the insertion of several muscles in the lower leg attach into those areas, those bones right there. So you have to address the lower leg as well. And that's another reason that it's not just about the toe or toes. So here we did that, and we widened the foot, the bunion angle or kind of decreased, and then we were able to get that into better alignment. Even the big toe is more grounded where this one is highly rotated. And yeah, okay. And then here's another combination bunion. Again, there was a rotation of the big toe, oops, which worked out much better, and a decrease in the bunion size. And that was after a year. Okay. The walking bunion, this is when the ankle, the arch, and the bunion are essentially in the same line, but then there's a big toe deviation. These are the guys that when you're walking, they are the ones that are having that a tracking problem of their knee that's actually causing the knee to go over the big toe or on the inside of the big toe and causing a big compensation there. And I will actually show you a picture of that. But here was a change in a couple weeks with the walking bunion. The walking bunions are the most challenging to address because they can go all the way up to the pelvis. So here's somebody who had the walking bunion. This is what I'm talking about. So if you notice when she's walking, look at where her knee was right here. It's all the way, all of the forces of the knee are coming to the inside of the big toe joint. So it's no surprise. Remember, we talked about Wolff's Law, where the body adapts to the forces acting on it. So what we did was we addressed that tracking problem and brought it more to an aligned position at the very end here with 2 sessions. This was somebody who came to see me, and you notice she's wearing some tape also that's helping her hold that position. The prognosis of the bunion type. So the forefoot bunion, that is excellent prognosis, even with surgery. These are people who sometimes do okay with those bunion braces, or the bunion toes, correct toes will work also for them. When it's the midfoot, those are usually pretty good as well, but it's the walking combination ones that are really challenging and have kept me on my toes, excuse the pun, trying to figure out a solution to them. Now, when it comes to prognosis, the more compensations, the greater the challenge with any kind of intervention. The more structures and joints that are involved, the more challenging the treatment or intervention. And the more important the structure is to function or performance, the more difficult it is to treat. So like those hallux rigidus people, in order for them to walk properly, or even with a walking bunion, they're doing damage every time they're taking a step. So I say that when you have foot problems, it's like you're driving a car on a flat tire. When you drive a car who has a flat tire, you pull over immediately to not damage the car. When it's your foot, you can't just pull over, but there are things that you can do really at the first sign of trouble. So that's where age comes in. The earlier you can intervene, the better. And how long, and that goes back to how long it's been going on. So I have a picture coming up in this presentation of an 11-year-old who has bunions already. So a lot of times this has been going on for a long time. It was maybe not noticed, or it wasn't thought about, or you felt, oh, it's not so bad. Maybe it'll just go away. It really doesn't. So there's a lot of misconceptions as well. So there's nothing you can do to change a foot deformity, and that's wrong because the posture of the body is dictated by connective tissue, not skeleton. So if you remove the skeleton from a body, the form of that body would not change, and connective tissue is malleable and can be altered. So the example I like to use for this is fish. So if you debone a fish, the fish doesn't lose its form. It maintains its form, whether or not it has bones or not. That's connective tissue. So a lot of people think, oh, it's a skeleton. There's nothing I can do about that. Yes, you can change it. Where it gets challenging is when something has been going on for a long period of time and there's a ligamentous laxity, meaning the ligaments have gotten stretched. That's when it becomes more difficult, but not impossible. The other misconception is that you can't do anything yourself, and that's wrong, because if you can see your feet, touch your feet, or move, you can do something. You can't change a large bunion. You can change it. You may not get rid of it, but it takes desire, dedication, and diligence. It is something that you have to be committed to if you want to do that. And here's somebody who did. She's somebody who had a bunionectomy on one foot and didn't want to go through it again. She had a tough time, and she was able, one of her big complaints was that she wasn't able to wear stylish shoes. So she sent a picture of her shoes after doing or working with me and doing the work that I'm going to share with you. So removing compensations and changing habits is the only way to permanently alter structure. And this is something that I call the Walker method. The circles, the big circles, are from my first day of PT school and orthopedics class. My teacher said 3 things. And one of them was release, realign, and reinforce. So that means you need to release the connective tissue that's holding the structure in a particular alignment, and then you have to realign. So if you try to realign, which is what surgery does, that's what orthotics do, that's what bracing does, without releasing, you're not going to really have success unless, again, it's fused. And even then, 10%, over 10% of bunion surgeries do fail, and there's recurrence. And then you need to, once you realign, then you have to reinforce. So what happens is that when you release and realign, you restore normal alignment. And then you have to keep it there. And the way to do that is by reinforcing that alignment. How do you do that? I do it with taping, because you can wear tape 24/7. And it takes 1,000,000 repetitions of something to be done properly for it to become what's called unconscious learned. So the last step in there is relearn. Now, we can also do this consciously. So when you have the body that can move into the proper alignment and have the mechanics that work properly, when you repeat that for 1,000,000 times, it becomes unconscious learned. But then when you know how to do it and you know how it should look, which again, no, most people don't. And I was a physical therapist and I wasn't taught the proper way. Well, I was a little bit more with gait. You weren't taught the proper way to do it. Well, then you're never going to relearn it. And the ultimate goal is to optimize function. So those are the steps. And you can't do any of them without the other if you really want to be effective. Like reinforcement only, that's exercise. But if you don't release or realign, it's not going to stay. Because the body sometimes doesn't even have the ability to do what you're asking. You have to give it that ability first. I love to use the example of trying to serve a tennis ball when you only can lift your arm as high as your shoulder. You're never going to be able to serve it properly until you release the connective tissues that allow you to have full range of motion. It's the same thing in the foot. It's just less obvious. So there's 2 release techniques that I teach. One is the comprehensive core release technique, and the other one is called rotational release. And the comprehensive core release technique is highly specific. And it is, if you notice, I'm using a pencil eraser head there. So we can show you this, how easy it is in a little bit. But why it's so effective is because we have these tiny little joints in the foot. So many therapists or other trainers will tell you to roll your foot on a ball. That does nothing to those small structures that will be involved with a combination bunion or a midfoot bunion, because those structures are so tiny that the joint spaces are literally so small that you really have to get in there with a small releasing tool. So I say, when it comes to releasing, size matters. The smaller, the more specific, the more superior the result. And the second one is rotational release. And this one is something that most of you will not have heard of. And I didn't work with this until a couple of years ago. But if you think about it, if you've ever studied anatomy or you know anything, we have 3 planes of motion and we move about 3 axes. Typical release only addresses 2 of the 3 movements. So when you are getting a massage therapist just works either on your front, on your back, on your inside, or on your outside of a particular body part. But they don't ever rotate. And rotation is a key component to movement, but is also a key compensation. As you saw in those pictures, many people compensate with rotation. So how do you uncompensate with rotation? You do rotational release. Then you'll do alignment that will hold you in the proper position. That may be derotation. So again, this is something that orthotics or braces or spacers will not address. Tape does. And that's where we're getting into, realign. So we realign with taping. And tapes vary in strength, the ones that I use. So the ones that are in the silver container are something called dynamic tape. It's fairly new to the market. I think it's only been around for maybe 10 years. And I love it. It is truly dynamic because it moves or it stretches and contracts in all directions. So it allows for all movements, right? So again, we move in 3 dimensions. It allows for movement in all of them, but it will allow for support at the same time. And what's fascinating about this tape is that its tensile strength is the equivalent of 33 pounds or 15 kilos. So the black tape can either assist, that means help move, a joint or a limb by allowing for 33 pounds of force, or it can also, depend on how it's taped, absorb 33 pounds of force. So it's like losing 33 pounds on your joints. So when you have that arthritis, like people do in the hallux rigidus, being able to offload a joint by 33 pounds can significantly change their symptoms. Does it take away the problem? No, because there's more to it than that. Like I said, there's you have to address the forces that are causing that misalignment to occur to begin with. That's causing that stress on the big toe joint, which is causing that inflammatory process. And then you have to address the core muscles that are being inhibited by the inflammation all at the same time. And that's what makes that one a bit of a more challenge. But any of these tapes, placing them on, so you have the dynamic tape, can be what we call facilitatory. And what that means is that they will facilitate the sensory structures in the skin and on the foot to have an increased awareness. And when there's an increased awareness, then there's a facilitation of firing or stimulation of those that particular area. In the middle is something called leukotape, and that is a lot of times used for blisters for hikers. This one does not stretch, but it holds real well. So before dynamic tape, I used leukotape quite a bit. Now, not so much. But it is an option if you have sensitivity to tapes, because of this, this white roll that's next to the beige. And that is a very, very soft tape that goes above or onto the skin and acts as a barrier to taping, because the downside of taping is skin irritation. And so any kind of barrier like a Band-Aid or that kind of tape, that kind of, it's called coverall, that kind of coverall will protect the skin, but then you can still tape it into a position. Kinesia tape typically does not irritate so much, but it doesn't do well in water. Dynamic tape actually has a sheen to it. I'll show it to you later. And it does really well in water. All of these are waterproof, which is excellent. But kinesio tape only contracts in 2 directions. So it is less effective than the others. Some of the benefits is that it's fairly inexpensive. Tape is only about $20 to $25, the dynamic tape per roll. The kinesio tape and the Leuco tape, the brown tape, are cheaper. It's specific to a muscle or joint. You can do it yourself. It reinforces any sort of release or treatment. There's that proprioceptive input, increase in awareness. It can be worn with any shoes or barefoot. That's key for a lot of people, particularly those of you who might have a hallux rigidus or limitus or pain. It helps with what we call neuromuscular education. That's the junction between the brain and the muscles. Improves alignment and support and decreases your pain, and allows people to wear stylish shoes without irritation and pain because, like I said, it can protect against blistering. It can protect the skin. Reinforcement is the last one. That's functioning in your new alignment. So with the foot, I love, it's easy. You know, many times reinforcement is just going out for a walk or a run. But there are certain special exercises that can facilitate those small muscles within the foot that get shut down with that inflammatory process that we spoke about. So there are some specific exercises that are ideal for this, and I'll show you one later. 98% of people reported improved mobility and elimination of their bunion pain using release, realign, and reinforce. So the goal of natural treatment is to, first you need to remove the cause because again, the result is a compensation. We need to restore alignment, and then we need to rebalance. So removing the root cause, release, restore alignment, realign, and rebalance is to reinforce.